Hello everyone, welcome to my channel. Today I am going to discuss about pulse pressure, how to calculate pulse pressure and what is the formula of pulse pressure. Pulse pressure. Pulse pressure is the difference between systolic and diastolic blood pressure reading. Pulse pressure is the difference between systolic and diastolic blood pressure reading. Formula of pulse pressure, the pulse pressure equal to systolic blood pressure minus diastolic blood pressure. डायस्टोलिक ब्लड प्रेशर जो है जिसको सिस्टोलिक ब्लड प्रेशर के साथ माइनस किया जाता है जिसको हम पल्स प्रेशर बोलते हैं तो पल्स प्रेशर इक्वल टू सिस्टोलिक ब्लड प्रेशर माइनस डायस्टोलिक ब्लड प्रेशर या PP equal to SBP, that is the systolic blood pressure, minus DPP, that is the diastolic blood pressure. So pulse pressure equal to systolic blood pressure minus diastolic blood pressure. The normal range of pulse pressure is between 40 mmHg and 60 mmHg. Normal range of pulse pressure between 40 mmHg and 60 mmHg. And a normal blood pressure, that is 120 by 80 mmHg. So 120 here the systolic blood pressure and 80 here the diastolic blood pressure. 120 जो टॉप नंबर इन द ब्लड प्रेशर जो रहता है जिसको हम बोलते हैं सिस्टोलिक प्रेशर एंड जो 80 mmHg that is the bottom number in the blood pressure is known as 80 mmHg. So here the 120 by 80 mmHg. So systolic blood pressure minus diastolic blood pressure. So here systolic blood pressure is a 120 minus 80. So here the 40 mmHg is a normal range of pulse pressure. The pulse pressure, the formula of pulse pressure is equal to systolic blood pressure minus diastolic blood pressure. Interpretation of pulse pressure. Interpretation of pulse pressure, high पल्स प्रेशर एंड लो पल्स प्रेशर. अगर पल्स प्रेशर जो है वो नॉर्मल से अगर हाई हो जाता है और कम हो जाता है तो क्या क्या कंडीशन जो है हम जो है देख सकते हैं. तो फर्स्ट है aortic regurgitation, aortic stiffness and other conditions, hyperthyroidism and cardiac tamponade. Low pulse pressure include heart failure or congestive heart failure, aortic stenosis, as well as the other conditions like hypovolemia, and constructive pericarditis. First is the aortic regurgitation. Here, the aortic valve does not close properly, causing blood to leak back into the heart. Aortic valve does not close properly, causing blood to leak back into the heart. Aortic stiffness, aorta का stiffness हो जाना. Then other condition like hyperthyroidism and cardiac tamponade. The cardiac tamponade is a serious medical condition where the fluid accumulation in the pericardium, the sac surrounding the heart, in that the compressing the heart as well as restrict its ability to pump blood. That means the cardiac tamponade means it is a serious medical condition here the fluid accumulation in the pericardium as well as ये हार्ट को जो है पंप करने के लिए रिस्ट्रिक्ट करता है. there is a when the high pulse pressure जब हो जाता है तो aortic regurgitation, aortic stiffness and other conditions like hyperthyroidism and cardiac tamponade. Then low pulse pressure include heart failure या congestive heart failure, aortic stenosis in that, and the other conditions include hypovolemia, constructive pericarditis. First, heart failure, the heart is not pumping blood effectively, and the aortic stenosis, the aorta valve is narrowed, and as well as they are the narrowing या stenosis हो गया है. Then other condition hypovolemia or constructive pericarditis. Hypovolemia, that means the low blood volume. There is an interpretation of pulse pressure, high pulse pressure and low pulse pressure. अब हम देखते हैं हाउ टू कैलकुलेट पल्स प्रेशर. पल्स प्रेशर का फॉर्मूला है पल्स प्रेशर इक्वल टू सिस्टोलिक ब्लड प्रेशर माइनस डायस्टोलिक ब्लड प्रेशर. Here one example. What is the pulse pressure if blood pressure is 140 by 90 mmHg? So here what is the pulse pressure if blood pressure is 140 by 90 mmHg? So pulse pressure equals systolic blood pressure minus diastolic blood pressure. The systolic blood pressure here 140 mmHg and 90 it is a diastolic blood pressure, that is a 90 mmHg, and the formula pulse pressure equal to Systolic blood pressure minus diastolic blood pressure. So systolic blood pressure here 140 and diastolic blood pressure here 90. And the 140 minus 90, that means the 50 mmHg. तो pulse pressure कितना होगा 50 mmHg. It is a calculation. How to calculate pulse pressure? Means pulse pressure equal to systolic blood pressure minus diastolic blood pressure. Here one example. A 40 years old man visits the clinic with complaint of dizziness and blurred vision. His blood pressure is recorded as 160 by 80 mmHg. What is his pulse pressure? A 40 years old man visits the clinic with complaint of dizziness and blurred vision. His blood pressure is recorded as 160 by 80 mmHg. तो व्हाट इज हिज पल्स प्रेशर? एक 40 इयर्स ओल्ड मैन है, वो विजिट करने क्लिनिक पे विजिट के लिए आते हैं विद द कंप्लेन ऑफ डिजीनेस एंड ब्लड विजन एंड द ब्लड प्रेशर इज 160 बाय 80 mm. तो व्हाट इज पल्स प्रेशर? तो फॉर्मूला हमारा बोलता है कि पल्स प्रेशर इक्वल टू सिस्टोलिक ब्लड प्रेशर माइनस डायस्टोलिक ब्लड प्रेशर. हियर सॉल्यूशन, the 160 that is a systolic blood pressure and 80 is a diastolic blood pressure. तो फॉर्मूला बोलता है कि पल्स प्रेशर इक्वल टू सिस्टोलिक ब्लड प्रेशर माइनस डायस्टोलिक ब्लड प्रेशर. तो पल्स प्रेशर इक्वल टू, तो सिस्टोलिक ब्लड प्रेशर हियर यहाँ कितना है 160 और डायस्टोलिक कितना है 80. तो 160 माइनस 80 दैट इज द 80 mmHg. तो ये नॉर्मल रेंज से क्या है, हाई है, हाई पल्स प्रेशर. तो हाई पल्स प्रेशर तो क्या हो सकता है उस पर्सन को? aortic regurgitation, aortic stiffness, as well as other conditions like cardiac tamponade, the hyperthyroidism. The next example, if a person blood pressure is 130 by 90 mmHg, so what is the pulse pressure? If a person blood pressure is 130 by 90 mmHg, so what is the pulse pressure? Write down your right answer in comment box. Calculate pulse pressure और जो आपका आंसर है वो आप कमेंट बॉक्स पे जो है वो आप टाइप कर सकते हैं. In today's class, we discuss about pulse pressure. Pulse pressure is the difference between systolic and diastolic blood pressure reading. Formula of pulse pressure is systolic blood pressure minus diastolic blood pressure.